So we are going to study about Broca's fascia. That means here the lesion is in the Broca's area. So here there is a decrease in the word output, okay, and the speech will be like non-fluent speech, okay, and the patient is having a significant agrammatism, okay. Her grammar will be full wrong. That is, she will be saying like today morning breakfast, like that, okay. So here the length of the sentence is significantly reduced, okay. The length of that phrase, the length of that particular phrase will be significantly reduced, okay, and it will be like a telegraphic speech, okay. It will be like a telegraphic speech. So in Broca's fascia, non-fluent and significant agrammatism, decreased word output, and phrase like this diminished significantly. And sometimes the patient with Broca's fascia will not speak also, but there is no problem in comprehension, and here repetition is affected, okay. Repetition is impaired or affected here. So what are the bedside features of Broca's fascia? Okay, these are features and the syndromes. So we will be looking for the spontaneous speech. Then I said that the spontaneous speech, that will be non-fluent. Sometimes the patient will not speak mute, or we can say it is telegraphic speech, okay. Next is naming. Naming will be impaired in this case. Broca's fascia, naming will be impaired. But here the comprehension is intact, okay. Mild difficulty with complex grammatical phrases, but comprehension is intact in this case. Repetition is impaired here. Reading is often impaired. Writing is also impaired here, and also the associated signs are right here: hemi, paresis, hemi, sensory loss, plus or minus apraxia of left limbs. Okay, these are the associated signs. Okay, so that is the Broca's aphasia. Next is the Wernicke's aphasia. In Wernicke's aphasia, the defect is in the comprehension. So in written or spoken language, comprehension is there is defected. So if we are like asked like questions and the answers will be not related, there is no comprehension, so question and answer will be not related, okay. And here this aphasia is not like fluent, it is fluent aphasia, not like here non-fluent, it is fluent aphasia. And another thing here seen is paraphasias. What is paraphasias? That is substitution in language. That is phonemic. That is, for hen she will sing pen, okay. For hen she will sing pen, that is phonemic. So that is paraphasias, that is substitutions in language will be seen. That is, one is phonemic, like hen we will be saying pen. Like that, neologism, like new words will be saying. For chair, chernoya, like that he will say, that is neologism. Completely new word is formed here, that is second. And with no meaning, okay. This word has any meaning? No meaning. This is semantic, that is, for pencil she will be saying chair, okay. So here the speech is jargon speech, okay, jargon speech. Okay, then so that's it. So fluent aphasia is there, then paraphasias, like that is substitution in language, is like 3 types of substitution. Then impaired repetition, here also repetition is impaired. And while we are looking the bedside features of the Wernicke aphasia, here the features: spontaneous speech is fluent, okay. In here non-fluent, it is fluent with paraphasic errors. We said no, like substitution in language, paraphasic errors usually. And it is usually not dysarthric, okay, dysarthria illa. This is naming. Here also naming is impaired. Often bizarre paraphasic misnaming, okay. Misnaming കാണും, പക്ഷെ naming എന്തായാലും impaired ആണ്. Comprehension is impaired here. Repetition is impaired. Reading impaired. Mainly for comprehension. Reading allowed, okay. Then writing well formed ആണ്, okay. Here the writing is well formed, paragraphic. And associated signs, right hemianopia, motor sensory, like usually absent ആണ്, mainly right hemianopia ആണ്. Okay, next is global aphasia. Global aphasia means both Broca's and Wernicke's aphasia both comes. Here the bedside features will be spontaneous speech will be mute or non-fluent, okay. That is, Broca's is involved here now. Naming impaired, comprehension, that is Wernicke's, so impaired, repetition impaired, reading impaired, writing impaired. So global means everything will be impaired here, okay. Associated signs like right hemi, paresis, hemi, sensory loss, and right hemi anopia will be there. And next is conduction aphasia. Conduction aphasia means here the lesion is in the dorsal, perisylvian, temporoparietal region. Here the bedside features are spontaneous speech will be fluent and some hesitancy Then here also literal paraphasic errors will be there. Then naming may be moderately impaired, comprehension is intact. So in conduction aphasia, the comprehension is intact, just like the Wernicke's aphasia. So just like the Broca's aphasia. But in Broca's aphasia, non-fluent speech, here the fluent speech. That's the difference, okay. And repetition is also severely impaired. Here reading is inability to read aloud, okay, that is the main. And writing is variable defects are there in case of writing, and associated symptoms like this. Apraxia of some limbs also present along with the triad of symptoms. Next is anomic aphasia is here. It is the most common aphasic syndrome after a trauma. Okay, after some trauma, Alzheimer's disease, metabolic encephalitis. In like that condition, after coming aphasia is anomic aphasia. Here mainly the lesion is in the angular gyrus. So significant difficulty in naming and word find. So here mainly the difficulty is in the naming. So here the spontaneous speech is fluent and circumlocution, and name is impaired. So here the naming is mainly impaired. Okay, naming is impaired here. Then comprehension is intact here. Also comprehension intact and others fluent. And the repetition is also here. Others also intact only. Okay, repetition is intact. Reading is intact. Reading is intact. So all others are intact here. Only the naming is impaired here. That's the point in anomic aphasia. Then transcortical aphasia is here. Here the lesion disconnecting or perisyllabial language network from association area. Okay. And this transcortical aphasia mainly result due to the watershed influx, that is MI, which leads to hyperperfusion of the brain, and this leads to the water influx. Okay. So here in transcortical aphasia, the main is here like the repetition is intact only. Okay. And this transcortical aphasia is of three types, that is transcortical motor aphasia, which is similar to the Broca's, and isolation, transcortical isolation aphasia, and transcortical sensory aphasia, which is similar to the Wernicke's aphasia. So in three cases the repetition, okay, repetition is intact. Repetition is intact in three cases. That is the main thing. And reading, writing will be intact in case of transcortical motor. Okay. So for easily finding, we have a classification here, that is classification aphasia. First we should look for the fluency. If the fluency is okay, that is fluent angle, it is yes, and fluent no. So that is the first classification. And next we should look for the comprehension. Okay, in case of yes and no. So in comprehension, if it is yes, we should put yes, and comprehension no. Like that also you have put here. This we should look for the repetition. Okay, repetition also you should, okay, if in case of yes, yes, no, yes, no, yes, no, like that you should put. So first fluency, comprehension, and repetition, and after that you should name. Okay, so here yes, no. Okay, and here first fluency yes, comprehension yes, and repetition also yes, then it is anomia. Fluency yes, then comprehension yes, but the repetition is only no, then it is conduction aphasia. Okay, so next is the comprehension is no, but here the fluency and the repetition is positive, that is transcortical sensory. Okay, and next is like that we should. So here the comprehension and the repetition is gone, that is Wernicke's. Okay, next is the fluency is gone. Okay, fluency is gone, plus the comprehension is okay, but repetition and repetition is yes, then that is transcortical motor. Okay, then we have the fluency is no, but the comprehension is yes, but the repetition is gone, that is Broca's. Okay, next is fluency is gone and the comprehension is also gone, but repetition is then transcortical, that is mixed. And in case of fluency is gone, comprehension is gone, repetition is gone, that is global. So anomia, conduction, transcortical, Wernicke's, like that. So that is the thing.